All right. Good afternoon, everyone. Good afternoon, everyone. You're welcome, Olasunbo Shorinwa. You're welcome to this live session. Welcome. You're welcome. EBO Jokes. You're welcome to this live session. Good afternoon, everyone. So, welcome to this exciting and enlightening health session. Hello to you too. My name is Oluwatimileyin, and today I promise today is going to be interesting because we are bringing a doctor that is passionate about women's health. Welcome, doctor. I'll be bringing you up now, doctor. So, okay. Dr. Mojoyinola, can you hear me? Okay. Let's see. Dr. Mojoyinola, please, can you exit and try to join back? I will try and send you the invites again so you can join us for this live session. Let's see. Okay, again, good afternoon, everyone. Good morning, good afternoon, good evening. I don't know where you are joining us from. So, we'll begin another live session today brought to you by TeleDoc and TeleDoc Foundation. And if you can hear me, please, can you please drop a comment of your location where you're joining us from. This is Lagos, so you can just, if you are in Lagos, you can comment Lagos. If you're in Port Harcourt, comment Port Harcourt. If you're in Ibadan, comment Ibadan. And like that, so that I can know that you are following me and you're with me. So can you please do that within 1 or 2? Okay. Sweet Dancer says she's joining us from EP. You're welcome. So today is going to be wonderful. It's going to be wonderful. It's going to be interesting today. Okay. Eddie says she's joining us from Scotland. Wow. Thank you. So while we are still waiting for to join us in this live, please, doctor, please, can you exit? I know you are here. Please, can you, if you can hear me, can you please exit and join the live back so that we can bring you up again? I don't know what is going on with the network and the live, something like that. So again, this is TeleDoc App. What we do in TeleDoc is we bring your doctor to you. What did I mean by that? It means that your mobile phone has now become your personal doctor. On TeleDoc App, you have the opportunity to consult with over 700 doctors. Are we talking about a gynecologist? Are we talking about an oncologist? Are we talking about a pediatrician doctor that deals with children? So on TeleDoc App, you have the opportunity to consult with them, have video consultation with them. They get to listen to you. They get to consult with you, write medical report for you, and you both of you get to solve any kind of health problem or health issues that you have right from your mobile phone and from anywhere you are in the world. So that's amazing. So Dr. Mojoyinola, if you can hear me, okay. We're still waiting for the doctor. Sorry for the delay. You know, as this network can be in Nigeria. Oh, thank you so much. Wonderful. Wonderful. What happened again?
Okay.
Hello, doctor. Can you hear me?
I can hear you, in fact.
Oh, thank God. Thank you so much. Thank you so much for joining us.
I had to go on my second phone, so I'm not really
Okay.
where I'm joining from now. Okay, it's okay.
Okay. So, everyone, good afternoon. Good morning once again from anywhere you are joining us from. And welcome to today's, I don't know what's wrong. Welcome to today's live session. I'm trying to bring Dr. Back online. So I'm trying to bring Dr. back online. Okay. I'm trying to bring Dr. back. Okay.
All right.
Okay. Okay, everyone. Okay, welcome to today's exciting and enlightening health session. My name is Oluwatimileyin, and joining me today is a respected medical doctor who is passionate about women's health and their holistic well-being. Today's topic is fixing common health struggles through lifestyle practice. And trust me, every woman will need to hear this. So if you know any woman around, just call them. You can message them to join us on this live session, and I promise you it's going to be wonderful. So because every woman needs to hear this, so before we dive in, please help me welcome our guest, Dr. Lola Mojoyinola. Thank you for joining us. Please kindly introduce yourself briefly to our audience, ma'am.
Yes. Good afternoon, everyone. So glad to be here. Please confirm you can hear me.
Yeah, I can hear you. Please go on, ma'am.
Okay. So I'm Lola Mojoyinola, psychologist by profession, and by profession, I'm also a board certified life physician. That means that I not women medically, quote, the gynecological way, but also use lifestyle, which is living, to also manage women. So my passion is all about women, preventive health, and
Thank you so much for that brief introduction, Ma. We really appreciate it. So if, before we begin this session, so to everybody watching us right now, so if you have any question during today's live, please can you please put them in the comments so that at the end of the live, the doctor, Dr. Lola can answer them one after the other. So if you have any issue relating to female or women's health, just put them in the comments. Dr. Lola will attend to each and every one of them. So, Dr. Lola, please let's start by identifying the common female health struggle you frequently see in your practice. What are the three top issues when it comes to you with?
oh well, there are quite a number of female issues. Remember, I'm a gynecologist obstetrician, so I won't talk about the obstetrics pregnancy is a common one. So talking about gynecology, we see majorly fertility, trying to get pregnant. So it is a common issue. We also see women with polycystic ovarian syndrome, commonly called PCOS. We see women, women with endometriosis. We see women dealing with fibroid, and less two common ones. We have women dealing with pelvic inflammatory disease, with UTI. The list is long, but majorly those are the common ones.
Oh, thank you so much. That was eye-opening. Another thing is, what will you say is the root cause of many of these issues? You talk about PCOS now. So is it mainly biological or lifestyle factor playing a bigger role than we realize? You understand?
Oh, well, for most of them, it's been seen that lifestyle factor really. Um, I've been in practice for quite. Uh, I've been gynecologist, so I've seen a lot, and I know that it goes beyond just the therapy, uh, medically. But some of these conditions, they actually require surgical intervention. But it's been seen and proven with research that quite a number of them can actually be managed first and foremost with lifestyle changes. And if peradventure it has gone beyond for a while, then you could combine both lifestyle and normal medicine.
You say because what me I believe is that all these conditions they're just common, they're just something biological. It can be related to let's say genetics or so. I really want you to just expand it for our audience. How away from genetics now, what are the likely lifestyle issues that can cause some of these things? This PCOS, we're talking about fibroid, and somebody is talking about endometriosis. I don't know, I'm not a doctor. Sorry about that. So there's a lot of them. So can you please just expand it? So before we now go into the acts of this conversation about that lifestyle issues. So expand our lifestyle factor, how is playing, that bigger role. So we might not really realize or understand this. How is, factoring into all these things away from genetics or biology, or hormones, something like that. Thank you.
Okay, so this common common, and I can tell you very common issue, because there's no day you run a gynae clinic and you don't find at least one of these issues. Not just one, quite a number, really, depending on the number of patients you're seeing. And
I think doctor is facing a network issue. Okay, you're back now.
okay, so
Yeah, you're back.
I was saying most of these issues actually could be a factor of how the person had actually been living, apart from the fact that it could have been genetic. It could.
Okay, so I think uh, Doctor will soon join us. I think is network. So, AB Ojokes, we got your question. We have your question. You want to know about IVF. So after the end of this live, we'll be talking about those questions. So if you have any question relating to female health, please just drop them in the comments. Doctor will attend to every one of those questions. So
I guess, am I back?
yeah, you're back, but we can't see your video yet. So we can, okay, can't see your video yet. Yeah, now. Please go on, ma.
Okay.
Yeah, we understand that this is Nigeria and network can be bad.
I'm using the best of what is available around here. Okay, so I don't know how far you got what I said earlier, as in this coming up as a result of either being dead, some running in the blood, or as a result of what the person had been exposed to as an individual, either growing, even as an adult. So there are many factors that actually make it to become so popular, and lifestyle changes has been very in managing a lot of.
Okay, thank you so much, ma. Thank you so much. So, if you can check the comment section, we've been having some questions. So, if you still have a question you want to ask Dr. Lola, please just be dropping them at the end of this question. And Dr. Lola will be putting them, she'll be explaining each and every one of them. So, thank you so much for that question. So, to follow it up. So could you please break down the top 3 lifestyle practices that can truly make a difference in this female health challenge? Like those 3 lifestyle practices, that can really make a difference. So let's just dive into that. The
All
floor is
right.
yours, one.
So when we're talking about life, we're um talking about we have 6 pillars. But, I just want to quickly make those 6 pillars, and they have the DREAMS. D for diet, R for restful sleep, E for exercise, A for avoidance of toxic substances, M for mental well-being, and then social connectedness. So when we're talking about 3 top essential, I won't say 3 top. If you don't mind, I want to make them 4. And
No
that
problem, no problem, no problem.
that includes diet, rest,
Yeah.
and note that I'm saying rest sleep, not rest, not sleep, restful sleep. So restful exercise, and of course, avoiding toxic substances. Those are 4 main lifestyle components that we can actually use to manage this with.
But please go on. You can still throw more light.
Okay, all right. So
Yeah,
when I about diet, let me from up there. So talking
yeah.
about diet, yes,
Okay.
we want to talk about what we eat, how we eat, quantity. We want to talk about how we cook, what we cook with, what we drink. Very important. Common saying is, you are what you eat, but not just what you eat. You are everything that's inside of you, whether from the mouth, from eyes, wherever it goes into your body. So when we talk about diet, we're talking about plant-based, whole food plant diet. We're talking about living out, living over processed diet, a large component, and you really want to deal with your diet to have good health, to also prevent, and as well as uh, if you are not exposed to them, prevent them, and also manage the medical in you already have one diagnosed. So that's diet. So much about diet. There are so many things, parameters, but the essential things are those things I've highlighted. What you eat, whole food, plant-based. Avoid processed food. Avoid junk food. Avoid over sugary, over salty, over fried food. Also want to manage how you prepare your food, the quantity, the combination, all those things. Then we're talking about the restful sleep. When we talk about restful sleep, we're talking about how well do you sleep? Do you have good sleep? A lot of us close our eyes, but we don't sleep. We wake up with what happened? Did I actually sleep? Body pain, this complaint, you are grouchy, you are on early in the morning. It's a factor of how well did you sleep. So there are things we call sleep hygiene. Talking about the environment you're sleeping in, the position that you're sleeping, the type of bed you're sleeping on, the temperature of the room, the lighting of the room, the sound in the room, the position, the gadgets around you, the routine in the night. Those are things, and the duration, very important. The duration. What time do you sleep? What time do you wake up? Is it consistent or haphazard? And so many things. What do you do on your bed? What do you do in your bedroom? Those are factors that contribute to. So rest is important. And there are things, we call them the routine, the important things that you follow to get that. Then talking about everyone needs exercise. And when we're talking about exercise, it's not a factor of I'm big or I'm small or I'm this size. It's not exercise is not weight loss only. It's a good factor when it comes to weight loss. But exercise is not only weight loss. And get very right. Everybody, young, small, young, old, big, small, male, female. But since we're talking about women now, exercise is exercise helps to regulate the hormones, the imbalance hormone. Are we talking about PCOS, talking about endometriosis, talking about infertility? Exercise is a friend. Or we want to talk about those that are already in peak. And when we talk about exercise, we're talking about doing something gradually so you are able to master it. There are different types of exercise. You can't be doing the same type of exercise. So we're talking about combination of aerobics, strength training, flexibility, stability. So we need to be involved in all. And very strength training is important for every woman. When we're talking about strength training, it doesn't mean you're going there to build muscles like the men. No, but we need to build those, increase our muscle mass. Because when we increase our muscle mass, it goes a long way in management of a lot of these things we're talking about. And then lastly, my number four important life factors is avoiding substances. And when we talk about toxic substances, we're not talking about the popular one, but let me mention the popular one. Popular one is alcohol. The popular one is smoking. Now there are different smoking types. E-smoking, shisha, mention it. They are all forms of smoking. And when you talk about alcohol, you see people saying, "Oh, is it energy? Is it red? Is it different categories?" Those can called the toxic things, but much more beyond that. And for what the state, especially where we are, is clamoring, is plastic. That is part of the toxins. We call some things endocrine disruptors, hormone disruptors. And these hormone disruptors are things that affect women majorly. They are the things that alter the normal hormonal balance, which we have coming up in a lot of gynecological issues. So there are so many things that what we are exposed to put on our skin, what we are exposed to physically, what we breathe in, so many things. Plastic is one amongst our cosmetics and other things. Are the four
Wow.
pillars that affect as women. Thank you.
Wow. Oh, I'm just getting to know about the plastic you mentioned. So you talk about the alcohol, the sleep, but the plastic, that one is a new thing for me. You talk about how it releases some chemicals that disrupt
Yes,
the
yeah.
bone. Is it all plastic?
Hmm. Plastics are not organic. They are chemicals. They are chemicals put together. The chemists will tell us how they put these together, mold them, and then become plastic. The thing about that, a lot of the chemicals that are used in making eventually tend to leak out of the plastic.
Yeah.
So apart from the fact that the one that is being propagated now is non-usage of the flimsy ones, the ones that people just throw away because of blockage, drainage, and things like that. But beyond those even tiny ones, we're talking about exposure to plastics, no matter what form, except you see, and if you've been very observant, you see some like those that use bottles, the reusable bottles. See non-BPA. Non-BPA is one of those chemicals that leaches naturally to whatever the content of that container is, whether it's liquid or is solid. And then you see quite a number of people reuse those plastics. It's not a, they don't discard them. So by the time you reuse, you put them either you're exposing them to heat or you're exposing them to freezing. You have these chemicals leaching. They're not physical, so we can't see. They are micro, very, very minute, and they leach gradually into the food or the drink that we've kept in those plastics. And before you know it, little by little by little, this plastic eventually gets into and we disrupting the balancing the hormones. And that's why you see quite a number of issues. Now we're not even there in the past, but because plastic is not like everyday use, we get to see this issue so often.
Honestly, thank you so much for that, ma. Thank you so much. So now let's get practical.
Okay?
For the woman listening now, I'm not a woman. So for people, for women that they are listening now, maybe she's overwhelmed or she's struggling with her cycle, fertility, or she has constant fatigue. What small step can she start taking today that will begin to turn her health around? Thank you.
Mm. Yes, Rome was not built in a day. That is a common saying. Little drops of water makes a mighty ocean. So you want to take a step at a time. This time we're talking is not what you can do a 360 degrees turn. You need to, first of all, be ready. Ready for change. Main thing. Have you been able to identify that you have an issue? You have no, or do you even maintain a healthy life for those, so that your future self will thank your present self by the time you get to. So it could be for a lot of reasons for different. But the main, you start gradually. Starting your assistance with guidance from coaches, from those are well informed about it. But you have quite a few that are misinformed and they are asking the information. You want to understand. Be careful, not just going on the internet and things together. It has to be guided. We want to start with the type of, are you junk food to ultra processed food? You want to go gradually to natural. You want to eat the food as close to natural as possible. So anything that's gone through the fat, all the you want to make a U-turn from there. If you are into fizzy, soft, sugary products, you want to reduce the content. You want to mind it's not I'm stopping today. It's not like New Year resolution. I'm not doing it again. No. It's if you are used to take 2, 3, some people take 10 bottles in a day, like that is their lifeline. So you want to reduce gradually, leave out a bottle, increase to 2 bottles until you are able to completely do it. And that's proof. So you need to do gradual steps. Time for exercise. If you've been so sedentary, you know that sitting and sedentary life has been seen to be equal to the new smoking. That's what. So if you sit for a long time, you're like a smoker. You know what smoking. So it's just equivalent. So you want to be active, you want to move, you want to be mobile. A lot of our work now involves us sitting down. So you want to incorporate a bit of movement. You want to do 30 minutes a day, or you want to get up every hour. You want to be intentional about what you do physically. Even if you have all the assistants around you, get up and move. Keep moving. For exercise, for sleep. You're a night owl and you're like, I'm best at night. You need to start calling that too and increasing your hours. If you used to sleep 2, 3 hours in the night, you want to let me add and let me sleep as usual. Those are little things that you can start incorporating into your normal every and before you the changes and
Thank you so much, Ma. So before we go into the question we have for you today, so let me talk about Dr. Lola Mojoyinola. If you go on her Instagram profile, you see something very wonderful there. You see, I'm very surprised when I see that she said she is the first female gynecologist. So, yeah, so she's available on TeleDoc App. I know many of you that you're watching us, you have questions relating to women's health and you want answers. And maybe your location might be far, you might not be able to go to a clinic, and you want to consult with doctor. You can just pick your phone, download TeleDoc App, just go there and just type Lola Mojoyinola. You see a picture, just book uh, appointment with her. You see her available time, the time she's available for booking. You see it right there. Click it and book an appointment with Dr. Lola. So now let's go into the question we have for you today. And I'm very, very sorry. Sorry, the question we have is relating to kind color. You've been seeing them. It's not really relating to lifestyle. So many people really want to know because a lot. So we'll try as much as possible to, try, and as much as possible to just briefly attend to those questions. Someone said, Diorioluwa, she said, can ovarian cysts disappear or resolve on its own?
yeah, on the size of the ovarian, we have different types based on the size and the type. So ovarian cyst is simple, complex. Complex ones don't actually disappear that, but simple one just like fluid in a balloon. That's simple ovarian cyst. And if it's just small, as it comes up, it also disappears on its own. So yes, you can have ovarian cyst. Very
Thank you. Another question.
intervention.
Okay, so thank you so much for that. I hope you are hearing Diorelua. So ABO jokes. She's saying what level of egg counts could be said to be okay for a woman to conceive? What level of egg counts could be said to be okay for a woman to conceive? What she's saying.
Yeah, level of egg count.
Yes.
With that type of egg count, that means it's not natural conception about. Uh, talking about IVF, because it's for natural conception is not a fact of what level of egg count, is more of how functional the ovaries are, and that comes to play with the check of the hormonal balance as per what those are the hormones that the ovary actually produce. But when you're talking about egg count, involves, uh, when you need to actually go and get eggs directly from the, and so that is a factor of so many other things. But for do IVF, that's not my area of specialty. So I won't tell you categorically what amount of egg you need talking about. But when we're talking about natural conception, there's no need for count. We use your hormonal level to know how fit to get pregnant.
Thank you so much for that. And also, she asked another question. I know that if she search on TeleDoc App, and she can have a one-on-one session with you also for that. So the final question that we'll be taking today is coming from Sasha David. She's saying, what are the symptoms of fibroid and how do you manage it naturally?
Fibroid comes to comes to play in different ways, and fibroid is a black, so it's not there is no one cap fit for. The way it's presented to someone may be different way it presented. So some of the features of fibroid include severe dysmenorrhea, that is very painful. It could be from fibroid, because fibroid through different, we call them degeneration. So it could be as a result of that. It could also be present in the hemorrhagia, uh, excess flow. Some people will be on their period, and the number of layers they used to put, they need to put on so as to avoid embarrassment. So you have excessive bleeding. The other thing that comes with fibroid is the growth, the size of the abdomen, that people will be wondering whether the person is pregnant or not. So, and then commonly is if everything has been done at conception and the still not able to see, and you see that the person has fibroid, that could also be a factor. So you could have errors for one to be able to detect that there is fibroid. But those ones are actually to the extremes. Quite a number of women have been going around that are presenting with symptoms, except a scan is done and then you pick that, okay, this person has fibroid. So not all fibroids are treated, not all fibroid need surgery. And depending on the size and the features, the complexity, symptoms that the fibroid is coming up with, that will determine what type of treatment you actually give the person. Natural management of fibroid, that can be done, and it has a lot of factors. Someone that's really looking can be fibroid surgery, but some levels that actually use not to get that level. There are lots of things that you can insight it.
Thank you so much, Doctor. So to Sasha David and to everyone that is watching me from anywhere, If you still have any question, anything that you need to share with Dr. Lola, you can always reach out to her on TeleDoc App. And this brings us to a close. Doctor, thank you so much for your wisdom, for breaking this thing down in such an easy to understand way. And also, before we end, do you have any final words for our women watching us, especially those who feel that they've tried everything? I mean, lifestyle changes, you know? So, can you please share it with us? If you have any final thing you need to share.
Yes. My heart is to every woman facing one issue or the other. God made the complex form. Not one woman has the same thing as the other person. We've seen we are individuals and our treatment and management to be individual. So if you're going through one thing or the other, know that there are different forms of therapy. Natural therapy, which involves using light, and you also have the orthodox medical therapy. And you need information to decide where to go, how to combine the two. Mind you, lifestyle does not stop or absorb you from the standard normal. There's a way we combine the two that the management is fast and the result is also obvious, faster than the before. So my word to you, book up to lifestyle medicine physician. And I happen to be the only one. I am proud of that. I am the only in Africa that has a combination of lifestyle and guideline. So keep fit, keep strong, keep living the diet, avoiding toxic substances, mental wellness, social connection.
Thank you so much for your time, Dr. Lola. To every woman watching, I want to tell you your health matters. And small, consistent lifestyle shifts can create a big healing. Don't forget to share this session. After this session is available, so you can always share this session with someone who needs them. Until next time, please stay healthy, stay strong. Thank you and goodbye.
Bye.